Today's episode is sponsored by Islamic Relief USA. For more information about Qurbani this year, please visit irusa.org/Qurbani.
Good afternoon. Welcome to another program on ShuraTV. My name is Dr. Zachariah. We're here on the health program. We cover a variety of topics so that you become well informed about your health and you take the best actions with your doctor's advice and increasing your own knowledge in terms of different aspects of medicine and health. We are in the summer months currently, and we hope that you're enjoying your time. A lot of people are moving about because the school year is over, and some people are moving home, some people are moving from cities to cities, and it's important to keep in mind that when we are moving things and we are lifting things, that we don't put out our back. Back pain is the number one cause of skeletal muscular pain in the U.S. in terms of injuries and pain syndromes. So it is the number one complaint that orthopedic surgeons get and regular family practice doctors get. And typically, back pain arises from a few variables that we can discuss. Number one, back pain is in terms of the budget that's spent on it. Yearly, there are millions of dollars spent on back pain treatments and prevention, and there's also chiropractic visits, there's medical visits, there's pain doctor visits, all due to back pain, and also surgical visits. And then there's also non-surgical treatments that you can seek. But the number one cause of back pain is going to be back strains and sprains. And this usually occurs typically because we, number one, our posture isn't correct. Our posturing, especially if you have a job that involves sitting down for multiple hours straight in a seat behind a computer, the back muscles tend to atrophy. And if you don't have some type of skeletal muscular exercise, it really leads to the atrophy of the back muscles, which in turn weaken the bones and the spine. So it's very important to keep that in mind, that as you age and as you approach your 40s, or you're in your 50s or 60s already, you need to do exercises that strengthen your core muscles and also your back muscles. These things will help keep the spine in good shape, and it'll prevent you from getting strains and sprains. It's very important. So we mentioned one cause of back pain would be sprains and strains, meaning that you might lift something in an awkward way, or you might lift something which is really a little bit too heavy for you. And if something is too heavy for you, some men or us men tend to carry things and think we're capable of doing it, but we really need to assess our strength. If you're someone who doesn't lift weights regularly, who doesn't lift heavy things regularly, and all of a sudden you're called upon to move a refrigerator or help with a heavy box, etc., you need to make sure that you use your knee strength, your leg strength together with your body, and have someone lift with you so that you don't strain your back and cause damage to your spine. Usually this pain that emanates from this type of damage is usually because we get pinched nerves and we get strained tendons in the structure of the spine. And then also we get pulled muscles in the lower back, the upper back, the mid back, and we get spasms as well. So these things cause chronic motility issues, maybe, and mobility issues, meaning that some people say, in a common term that they use, is that, oh, I've thrown out my back. Throwing out your back is usually a muscle or a tendon that has been stressed or strained. And typically, to treat that, we'll discuss that in a little bit, that's one of the main reasons that happens. And if this happens often enough in your young age, then what happens is that this leads to degenerative changes in your spine. And those things will manifest later in your life, in your late 40s, early 50s. Some people in their 60s, they'll have all types of back issues and tendon issues. Also, if you're standing at your job or at your whatever you do, hobby, job, or for extended periods of time, that's another strain on your mid-back. And a lot of people experience this back pain up near the shoulder blades. They get this nice little spot between the shoulder blade and the spine, which always aches and it gets stiff, and the muscles are usually very stiff. And to alleviate that, we tell people that if you're in a situation where you're standing all day, or for example, a surgeon would be on an OR table and they've been looking down like this all day, the whole weight of their head is burdening their back muscles all day. So what you need to do is expand the chest, the shoulders, the arms. They need to be expanded, and this exercise needs to take place multiple times during the day so that the stiffness of the back muscles is alleviated. That's something which you need to keep in mind. And these strains happen, and frequently it's because you're bent forward and you're looking down. Same thing with computer programmers, engineers that are working at desks and tables. You're always looking down, and the heaviness and the weight of the head and the shoulders being crunched up and not expanded leads to that friction in those muscles and the spasming and the stiffness and that and the pain points. So these are things that cause the strains to the back. So we have to kind of be cognizant of this, and then once we're cognizant of this, we utilize exercises and add to our routine so that this doesn't happen often to us. Always what we recommend is within the hour, if you're doing something for 30 minutes, standing, in a position which you haven't changed, we often advise to take a break and do a couple of stretch exercises, walk outside, stretch your arms, expand your shoulders. All these things will help alleviate that condition or that sprain in the back. The other issue is, injuries. You're more prone to injuries if you're lifting and you're doing things that cause impact to the back. Those types of injuries usually cause nerve impingement, or they cause your lumbar spine to be misaligned or misplaced. And when that happens, that has a sequelae of things that happen after it, starting with a pinched nerve, and then you get tingling and less numbness of sensation down below in the appropriate areas of the leg that are assigned to that nerve. So each nerve has a specific area which it innervates. So when you damage that nerve at the root, the branches will suffer with tingling, numbness, and pain. Or heat. So these are different types of nerve damage that'll happen. A lot of people call it peripheral neuropathy or peripheral nerve damage, and this can be avoided if you keep in mind your health of your spine and your back, and prevent yourself from suddenly lifting things or doing things that are high risk and that can cause trauma to your back. The typical response when you go to your primary care physician, as you should go and discuss any type of pain you have on your back initially with the primary care doctor, they'll definitely give you some type of physical therapy. They'll give you some type of anti-inflammatory medications, and if those work, wonderful, it's alleviated. If not, they might refer you to a pain doctor or a orthopedic surgeon for further evaluation. Typically, 60% of the people with physical therapy and some type of anti-inflammatory medication, after 2 weeks, they get relief. But if you're not getting relief of that back pain and it continues to bother you, then it's important for them to give you a referral to your primary care doctor, or to your to your pain doctor, or to your orthopedic surgeon, so they can further evaluate it. And that's very important, because you want to know what the issue is, because in order to have a good, full, active life and with good longevity, you don't want to be burdened with such strains and pains that are becoming chronic. In the ortho's office, they might offer you some corticosteroid injections. Nowadays, people get what's known as platelet-rich therapy, which is PRP injections. Those are better, and they have more of a healing characteristic than the corticosteroids, which just mask the pain. I would opt for the PRP. Discuss that with your doctor. And then if those things don't work, they'll offer you surgery and an MRI or a CT, depending on what's needed. You get your MRI, they'll read it for you, they'll tell you what's going on, and they'll let you know if you're a surgical candidate. A lot of people, in terms of the MRIs, might have a normal MRI, but they still have the pain emanating from their back. Usually we'll recommend to them to go to some non-surgical treatment center where they can give them some alternative therapies like the platelet-rich plasma, which is PRP. The PRP usually lubricates the joint, decreases the pain threshold, and as well decreases the pain, period. And then it also, on the cellular level, rejuvenates and actually repairs some of the damaged cells in the joint. So these things are there, and it's important for you to take advantage of them and talk to your doctor about it. Currently in the U.S., in terms of surgery, surgery for your back should be the last option. If you've exhausted all other means in terms of treatments and protocols that you can seek for back pain, then surgery would be an option if you're a candidate. Your orthopedic surgeon will let you know if you are an ideal candidate, and things that you can do that are practical is number one, lead an active lifestyle where you're consciously increasing the core strength of your muscles, the core muscles, as well as your back muscles. You're doing exercises that are stretching your back muscles, and your back muscles aren't in a static position for long terms of time. That's something important. And then second, it's very important to keep yourself hydrated. Hydration is very important for muscle health and muscle functioning, especially your back muscles from spasming. A lot of people, usually their electrolytes are imbalanced. They're not balanced, and we always recommend to have a alkaline source of water which has electrolytes with it. That's great. If you can't do the water tap, and then of course there's fruits, vegetables. If you're getting those things, they have all the minerals and nutrients that you would need, provided that you're absorbing them well. Potassium is something which is deficient in a lot of people who have spasms of the muscles, so we would recommend to eat things that are high in potassium, as well as keep the hydration, and then keep the tension and the exercise at least 3 times a week for your muscles. You can do resistance exercises if you're older and you don't want to overburden your joints with weight exercises. You can do resistance. Resistance is very good. Resistance is something which gives you the same impact and the same benefits as weightlifting, but it does it without stressing your joints and causing that extra weight on the joints and the wear and tear. So that's something very important that you need to keep in mind if you're 40 and above. In your 30s and 20s, you can weight lift nicely, provided that it's something that's feasible to your body's size and strength. These are the things for back surgery. One other issue is that 60% of all back surgeries fail in the U.S. So that's something to keep in mind and discuss with your orthopedic surgeon. Nowadays, they do have microscopic techniques that they utilize, and it's very specific. They do laser surgeries. They do all types of new technologies that are utilized for the back. So the more precise they are, the better the results, and the better, the less side effects in terms of your surgeries. So that's very important to keep in mind. Other issues with back pain were just the financial burden on the medical system. It's huge. Chiropractors. A lot of people tend to go to chiropractors for adjustment. The advice would be to go to a chiropractor that's not so aggressive. We see injuries from chiropractors. They have good intent. They want to readjust the spine and align it, but it's important to go to chiropractors who are balanced and have a balanced practice, and they're not just over adjusting you every time you go, because that friction between the bones and those adjustments can also cause wear and tear that's unwanted. And we've had people that have gone to chiropractors and their injury has been exacerbated, meaning that the injury, instead of getting better, it gets worse. Same thing happens sometimes with over-aggressive physical therapists. You'll go to a physical therapist and you say you have back pain, and they're stretching you out and they overdo it, and instead of causing you to heal slowly, they'll cause more damage. So you need to be the advocate for your health, and you need to talk to them. If you feel a strain, or if you feel that the chiropractor's putting too much pressure on you, raise your voice and let them know. That's the number one thing you can do. Say, hey, that's too much. I can't take that. My body can't take that. You are the best judge of your body's capacity and its threshold. So you have to raise your voice, and you have to let them know, whether it's physical therapy, chiropractor, or if you're with your doctor and you don't feel that he's paying attention to that issue that you're bringing up. You got to raise your voice. That's the number one thing you can do to achieve better health in the long run. You have to be an advocate for your health. Medical prescription treatments, typically they'll give you anti-inflammatories combined with some type of muscle relaxant for the back. And then the other extreme is if there's nerve damage in the periphery, they'll give you medications like gabapentin, and there's a couple of other ones, and that's, you're on it chronically. So that's, you don't want to be there, but if you have to, you got to do it. If that nerve pain is consistent, you have to do something that alleviates it. On the natural side, turmeric is something which is very, very good for nerve pain and back pain. It's anti-inflammatory. It's very important, and if you take that with a little bit of black pepper and black seed oil, that's something which decreases the inflammation across the board on all your joints. So that's something to look into. There's a lot of research on that, and you could look it up and see the benefits of turmeric on joint health. That's important. And then also collagen. Collagen is another thing that you can take that helps lubricate the joints and the stiffness from the back. So that's something important that you can do as well. I think those are the things that we mainly want to discuss with back pain. If you do have back pain, again, get an assessment from your primary care office, go to your doctor, discuss it with him. Take your supplements, vitamins, and hydration. Keep that ongoing throughout your treatments, and then see what they assign, and be an advocate for your health. You have to be willing and participating through the whole thing so that you can get a good healing. With that, we'd like to wish you a farewell. We'll see you next week with another program. Thank you very much for attending, and looking forward to all your comments and suggestions on the comment section. Take care.
Today's episode is sponsored by Islamic Relief USA. For more information about Qurbani this year, please visit irusa.org/